Is that the most likely way for this to end, that you peel off a couple more Democrats, or does there need to be some sort of agreement in principle on Obamacare subsidies?
Well, this was already the negotiated bill that we passed out of the House of Representatives. Remember, this is a continuation of existing funding levels that Senator Schumer himself negotiated last year, voted for, and then Senate Democrats joined in a bipartisan fashion to extend it 3 times since then. So the idea that they don't want to vote for it now and they were willing to shut down the government was not only a surprise, but I think it was a really bad move on their part, because as you mentioned in your report, it's difficult to get out of this now. And the Senate keeps bringing up the same bill over and over, hoping that 5 rational Democrats will just vote for the same bill that they voted for 4 times already. That is the easiest way to get out of this. And I think it's the way it's going to likely we're going to get out of this. But in the meantime, you're seeing a lot of pressures in the districts. We're seeing, military will not be paid on the 15th. We're seeing the women in infant and children's program will run out of money. That's a nutritional program that is very important to many of our constituents. You're going to see probably delays at the airport as a result of TSA agents who are not getting paid, being frustrated. And you'll probably see a lot of other things unfolding, and the economic impact, of course. The GDP will be affected. Consumer spending will be affected. This is costing the taxpayers $400 million a day. And it's unfortunate that we came to this point. It was absolutely unnecessary. All we needed were the 7 Democrats to join the 53 Republicans to get the 60 votes necessary to pass this bill, just like they've done before.
And to think that the Democratic leader in the Senate is from your state, and you're surrounded by Democrats in New York, maybe not in your district, Congresswoman, but what are you hearing when the cameras are off and guys like me are not around? Will there be some common ground here at some point? Do you see an off-ramp?
I hope there will be, but it's completely in their hands at this point. Remember, this passed out of the House on the 19th. And if Senator Schumer should just vote for the same bill that he supported 4 times before. And the impact here in New York, it's 61,000 military personnel that won't be paid. I went around the district. Our VA hospital, thankfully, is operating as it always is. The clinic on Staten Island is running smoothly as well. The national parks are all clean. I took a look to see if we had any maintenance issues as a result of the furloughs. We don't at this time. But people, I think, will start feeling it more and more as time goes by. And what has changed since the 4 times that Chuck Schumer supported these funding levels that he himself negotiated? The only thing that has changed is President Trump is now the president. We know that they don't like him and they want to, do this to I think, put pressure on President Trump. And the other thing that changed was that Alexandria Ocasio-Cortez and the left wing of the Democrat Party threatened to primary Senator Schumer. Those are the only 2 things that have changed here. Everything else remained the same, including the text in the bill. Now, they're trying to add other types of outside policy initiatives into this clean funding bill. If the tables were turned and Republicans were trying to jam outside policy, the scrutiny from the media and the public would be outrageous. So I just ask people to be honest about what's going on here and say, look, there's nothing wrong with a clean extension of the funding levels that Senator Schumer negotiated and voted for 4 times. He should just give the 7 votes. Let's open the government, and then we can have a serious discussion about some of the other policies, which I agree on some level that we need to do something about, certainly the Affordable Care Act, because it is not affordable as they sold us when it passed. And we could talk about some of those other subsidy issues, but we will not accept by any means $200 billion going to states that make its way to fund illegal immigrant health care. We will just not accept that. That is not negotiable.
Well, okay, so there's a lot there, Congresswoman, but I still feel like I heard the glimmer there at one point that there would be some common ground if the government reopens. With regard to illegal immigrants making their way to hospitals, and the way that you said that, by the way, is duly noted. This is money that comes from the federal government. States use it as sort of a fund to help hospitals from going out of business if people can't pay for their care. What's the option, though? You let them bleed out on the street?
Well, no, but First of all, this should be on the states. The federal taxpayers should not be paying for the sanctuary policies at the state and local level. That's number one. Number two, our emergency rooms should not be utilized for common colds and other things that they have been, which leads to tremendous overcrowding and actually hurts people who are in serious emergencies. They should be going to a clinic, one of the local health centers, and paying out of pocket if they have a common cold or something else. So let's differentiate and make sure that people understand that they are going for emergency hospitals when it's not an emergency.
For
and the
routine
taxpayer
services,
is picking
understood.
up the bill, which is a tremendous burden. In New York
I
alone,
appreciate
it's about
a thoughtful answer on that,
500,000.
Congresswoman. Yeah, the numbers are staggering. I completely understand. I want to ask you about what Russ Vought is talking about and whether an RIF, if that happens tonight, the White House says it could come after this failed vote, if that is in fact what takes place this afternoon. Does that make it more difficult for frontline Republican lawmakers in blue states like yourself? Does it make it more difficult to get a deal here in Washington?
Look, I think there's no easy answer here, but the reality is that the taxpayers are paying $400 million a day to pay for individuals who are currently furloughed, not reporting for work. And so if Senator Schumer continues this shutdown, we're gonna see the consequences of that. You probably will see some action taken to try to save the taxpayer money. Now, all of this, again, can be ended today because at 5:30 there will be another vote, and they can just vote for the same bill they voted for 4 times, and this is over, and this type of pain will be prevented. And so far, our military personnel have not missed a paycheck because they'll be paid on the 15th. They were paid on October 1st, but they won't be paid on October 15th. And so that's an important deadline as well. We're hopeful that if we can't come to some type of resolution, that Speaker Johnson will bring us back to at least vote for a bill that I'm proudly co-sponsoring that would allow for our military troops to be paid. And you should also know that many members, including myself, have asked the Treasury to withhold our paychecks to be in solidarity with our military men and women. So we're hoping to get this resolved. Again, Senator Schumer is the one that really has the power right now to end this. And then we can talk about the subsidies. If you want to get into that further, I'm happy to discuss it. But the reality is that the insurance companies have profited 230% increase since the Affordable Care Act has passed. The Affordable Care Act was not affordable by any means, and it has put tremendous stress on the taxpayers who are paying those subsidies to insurance companies, not actual individuals.